let's go ahead and reveal for the next stage the question with the multiple choice answers, and we'll have you choose what you think is the most correct answer in the poll. So prior to discharge, what is the most appropriate next step? A, obtain a CT scan of the head. B, obtain a swallowing evaluation. C, place a percutaneous endoscopic gastrostomy or PEG tube. D, prescribe fludrocortisone. Or E, prescribe prophylactic levofloxacin. Well, let's go ahead and reveal the correct answer. And that was B, obtain a swallowing evaluation, which all of you got. I'd love to hear from any of the students about your approach to this question, having the option set in front of you versus when you didn't.
Yeah, so I think I like to do with these questions, or any question, is kind of grade the, I guess, severity or invasiveness of the intervention. And so when I looked at the options A through E, also looking at the clinical context and then matching that with what level of intervention you're being offered. So with the CT scan of the chest, even though we're dealing with a pneumonia, I would still think it's something we can monitor with a simple chest x-ray. So a CT sounds like too far a step to go for. Placing a PEG, again, we don't have enough information to really go that route. We've been talking a lot about the functional status of the patient, and that's certainly something we might want to consider. But at this point, we don't have enough information to go to that invasive a step. And so looking at all the other options, a swallowing evaluation seems like the least invasive option, but still gives us kind of critical information that we need to fully assess the patient.
Great points. Any others?
The other options seemed a little extreme, and I may not have thought originally when I saw this question, like next step, swallowing eval, but seeing the options, that seems the least invasive and the least extreme out of all of those.
It really comes down to, is the option going to either guide your management, or is it going to, or is the therapy indicated? So the CT scan for me, it didn't seem like it really guide my management, because we kind of have established clinically that this patient has pneumonia. And the other steps, whether it's the PEG tube or the steroid repletion or the antibiotic therapies, none of them seem to be indicated at this time. The SLP eval actually does seem like something that would benefit the patient, and is something that's appropriate and indicated therapy.
Yeah, you can definitely now make a connection between the actual presentation of the pneumonia and the likelihood of his swallowing being impaired, considering his underlying neurologic condition. Nobody put swallowing eval in the actual chat when you had it. You put in med reconciliation, which again, I think is always a good answer for a question on a patient like this. But just thinking about the approach to these items, how did that change your thought process?
I think in some sense, a lot of these times with the vignettes, there's a lot of different information coming at you. And again, like Alex mentioned, we're talking about acute and chronic problems in the same vignette. So sometimes I think the questions can guide what you should focus on. And I think that's the case here as well. I mean, when you're looking through the options in the questions, there really is one best answer based on the clinical picture that ties in what's going on with the patient and what a best next step would be. I think a med rec would also be a good next step. I think correcting orthostatics, like someone mentioned in the chat, would also be a good next step. But the questions can kind of guide where your thought process should go.
It almost begs for a new type of question in the future, where you're sort of prioritizing what you're going to do in order and in the time course. And we certainly don't have patients walking into the ER with A through E written on their chest, right? So that's the challenge with the format.
I think, given the fact that a lot of us talked about medrecs, the fact that we were really, a medrec is a way to assess the functional status of a patient and how they're responding to certain medications, especially given this patient's decline. And so looking at the answers, even though a medrec isn't on there, the idea of obtaining a swallow evaluation is another way to assess the functional status of the patient. So in my mind, that answer is kind of in the same vein as what we had talked about, even without having any of the answer choices.
Great point. And I think, you know, you can massage this a little bit, that if the medication list had some other types of medicines on it, like an anti-nausea, antiemetic, or psychotropic, you might be drawn to that as an option right away. And it's always important to remind students that you think of a case like this, and think of all the other types of questions that could be asked about this patient. It wouldn't necessarily just be most appropriate next step right now as they present. It could be prognosis. It could be referral. It could be what consult would you get, things like that.
So if the patient was getting worse and not better with a diagnosis of pneumonia, made both clinically and by x-ray, then a CT scan of the chest might absolutely be the next appropriate step here. But they're not giving you that information. So you should not assume that the patient got worse unless they give you that information. Do simple things. Do clinical medicine, right? This is why we've got involved in this, in caring for patients. One of the simplest things on this list is a swallowing study. Now, I may not know how to do that, but I've watched them, and I know there are people, nurses, others that are trained in evaluating patients. It's a simple bedside test. When you're given an option set from doing almost nothing or something minimally invasive to maximally invasive, like putting a PEG tube in place, think about the vignette, think about the patient, put yourself at the bedside and say, well, based on what I know, what's the least invasive thing I can do to this patient to get the most information back?
This actually, it made me consider the fact, I would think an interesting question would be if MedRec actually had been one of the choices in this answer set, because it really does make you think about what that classic thing of like what the best next step is. And, all of us as students, as fairly experienced students said MedRec, but then when you think about what they're asking in the question set, that he potentially has an aspiration pneumonia and potentially he's having such an issue with swallowing that maybe he's not getting enough fluids in, that even though all of us had said MedRec, even if you had put MedRec in this question set, really a swallowing evaluation would have still been the correct answer. So I just thought that was interesting to reflect upon from an actual clinical standpoint.
What if B was not in the option set? What would have been your second choice and why?
Oh, I was just thinking, none of them are fantastic options, but I think responding to the orthostatics is probably the next best step. And it's also going back to what I think Colade said earlier, sort of the least invasive. So prescribing fludrocortisone is probably where I would go.
I was just going to say, if that answer was excluded, I guess it would almost change the way I thought about the question a little bit as well, because it would kind of lead me more towards thinking about the chronic condition as has this progressed into more like neurogenic orthostatic hypotension along with the dysphagia, creating like a different clinical picture and saying, do I have to prescribe fludrocortisone to this patient? So, just something else to consider.
Right. I think fludrocortisone isn't the most appealing option, considering we haven't maybe given this guy any fluids yet, as far as we know. But certainly, in terms of chronic management, you would expect postural instability with Parkinson's. You wouldn't necessarily have autonomic instability, typically not until later stages of the disease necessarily. So.
Yeah, I just was going to comment that it's an interesting exercise doing these questions that we're so used to having answers for, to not have them beforehand. It almost be interesting to like take a whole test that way and just see like, what would I say? And then what are the options that are given to me and how close am I thinking? Am I going for am I jumping to the red herring based on the information given? Am I kind of playing within the confines of the question? Just going to be a fun thought exercise, I think.
I think it's awesome that you mentioned that, Colade, because that's pretty much how I prefer to study. Really just like covering up the answers, trying to come up with the answer first, and then looking at the questions. I think that's a really useful way to learn the info, or like test yourself before using the answers to guide your thought process.
Based on this experience, what other tips would you share with your fellow students that are going to watch this about approaching these questions?
I like to always glance at the options before I start with the question, so I know what it's kind of going to be about. Like if they're all just medication names, then I know what I'm going to be starting to think about. And sometimes I like read the last sentence before like what they're going to be asking, but usually I just start from the top. And but yeah, I always glance at the options first to see what kind of direction I'll be going in for the questions.
Yeah, I find there's never one size fits all approach to question stems. Kind of like Claire was mentioning, sometimes you can read the last sentence or read the answers in the last sentence and the sentence before that, and it gives you pretty much everything you need to know, and you can move on. but I find with a lot of questions, especially psychiatry questions, that the option, you know what the options are going to be essentially, and the point is for you to read the vignette and understand the whole context. And so I think it's just important for students to be flexible in their approach and recognizing when they can kind of not necessarily cut corners, but can be a little bit more speedy, and when they're going to have to sit down and read the entire vignette and kind of gestalt it a bit more.
Yeah, I would agree with Kalade, and I have many friends that approach it in the exact same way as Claire. But I also, you know, through the time of toying with different approaches, I have found that sometimes I will always read the last sentence to see what they're asking me. But I have found that sometimes if I read the answer choices, I will like anchor myself to one of the choices, and then as I'm reading the vignette, I'm like convincing myself that one of the choices is right. So I actually stopped doing that at some point and saw myself make some increased, get answers that were a little more tricky just by not anchoring myself as much. So